I'd like to show a case that really has more than amazed me. It's probably the greatest result that I've seen in an interceptive treatment, and it was using only Invisalign aligners, not the Invisalign palatal expander, which is an effective new appliance. But these are Invisalign aligners. The system is known as Invisalign First. In the middle, you see the patient. That's treatment plan 3 that was accepted, and that was in September of 2022. And this result over here was about a year ago. Treatment plan 13 was in December of 2023. And at that point, I just made 7 aligners to kind of make the slightest bit of improvement, and the patient only wore it at night. And here is a recent scan that was taken at a follow-up visit, I think just a couple of weeks ago, actually last week, December 21st, 2024. And the overjet even further increased. And let me explain. I'm going to take off the mid-treatment and just focus on where the patient is now and where they started. So the knock on Invisalign in terms of expansion is that it's not a skeletal expansion. This is an arch expansion that was created by aligners. And to me, it's insignificant whether it was skeletal or not, because you can see the profound change in the arch width and the flattening of the arch. As you widen, you create additional space that allows you to retract these teeth. Interceptive treatment is really important at this age because these teeth, when this patient was, he was probably 8 at the time, very vulnerable to injury. They are exposed out, no support. And the lower lip completely sits inside here, if not the tongue. I don't remember whether there was a thumb habit, but the reason I mention those muscular forces is because once you get the teeth in the ballpark, then the teeth, and my plan was to have an overjet that would still be residual to this extent. And this, look at where it is now. And my explanation for this is that the patient wearing these aligners, it can deprogram patients sometimes, and maybe that will allow their jaw to migrate forward, which I've seen with aligners, even without elastics. There were no elastics here. So that's what amazes me about this. And it was not a positioning forward. I thought it might be, but you can see that the molars are still in solid occlusion and still end on. That's because you still have this large E over here, which the leeway space will allow for some migration of this tooth. But I had to look at this a few times. I'm going to probably at the end put a smile photo before and after, just so people can know how the patient started, that I didn't fudge anything here. And so this is just tremendous using Invisalign First. I don't use fixed palatal expanders nearly as much as I used to, because the Invisalign First really changes the architecture of the mouth. I do not take occlusal radiographs to see if the suture split with the aligners. Some of my colleagues have thought that even aligner forces on a young patient might allow for a sutural separation and indeed a skeletal expansion. But the reason why this is not just a tipping movement, if you look at the buccal segment, look at the occlusion of the upper and the lower. And I did expand the upper and the lower. If it was a pure tipping, you would see these teeth really tipped out in a poor occlusion. And now we're just waiting for more teeth to come in. And so this is a dramatic result, and I want you to see what Invisalign is capable in this young segment of the population, age 7 to 9, in the interceptive phase. And you know what? The kids this age are great with their aligners. And it's surprising. A lot of parents think they won't wear it, but they do. And so give it a shot if your orthodontist recommends it, or ask about it, because it's an amazing tool to treat both the upper and the lower arch. I have to tell you one more thing. If this was a expander in the upper arch, I would not be treating the lower, most likely. I wouldn't even expand the lower. I would wait till they were older. But now look at how the lower aligned up at the same time as the upper. So again, stupendous result.